Erectile dysfunction is the inability to obtain or maintain an erection satisfactory for intercourse for both the male and the female partner. Erectile dysfunction, unfortunately, is very common. It affects 30 to 50 million men worldwide. And you got to remember, those are the 30 to 50 million men that will admit to having erectile dysfunction, but very common problem. The most common causes of erectile dysfunction are vascular disease, such as hypertension. Diabetes is a big cause of erectile dysfunction. And some surgeries cause erectile dysfunction, such as radical prostatectomy, cancer surgery for prostate cancer, and colon cancer surgery as well. Erectile dysfunction you can really diagnose from a good history and physical examination, just talking to a patient. However, in the office here, we do use penile Doppler testing to give us a better indication of patient's degree of erectile dysfunction. So people ask me very often, can you prevent erectile dysfunction? And in reality, I really don't think it's a preventable disease. If you stay healthy and you're not diabetic, you don't have vascular disease, you have a lower chance of getting erectile dysfunction, but I don't think there's a specific way you can prevent erectile dysfunction. I think the biggest benefit to seeing a specialist for erectile dysfunction is we deal with this on a daily basis, so we know what works, what doesn't work. I think it's best if you see a prosthetic urologist, somebody that performs penile implant surgery. That type of urologist can deal with any type of erectile dysfunction and can offer you any type of treatment that's available. The treatment options for erectile dysfunction, I'm going to break down into two major groups. There's patients that respond to pills. If you respond to the general pills such as sildenafil, which is Viagra, or tadalafil, which is Cialis, that's great. So that's one group of patients. The problems really occur when you don't respond to pills, and that's when things get a little bit more complicated. That's about 40% of patients. So there is a vacuum pump available, which is a cylinder that goes over the penis. It creates a vacuum within the cylinder. It draws blood into your penis, and there's a band that keeps it erect. I hope it doesn't sound appealing because the patient satisfaction rate is about 1% with that. We can teach you how to do injection therapy, injecting medicine such as Trimix into the penis, which will give you an erection that'll last for a couple hours. However, the gold standard, what has the very highest patient satisfaction rate, about 92 to 96%, is a penile implant. So what treatment is right for you as a patient, or how do I determine what treatment is right for you as a patient? I always tell my patients, if a pill works for you and it works well and you don't get a lot of side effects from it, that's the simplest way to treat erectile dysfunction. However, with that being said, 40% of patients don't respond to pills at all. That being the case, if you're a candidate, a penile implant is by far head and shoulders the best treatment on the market. It's a permanent solution. The other treatments that are available really don't work as well, and I'll present them to you. If you wanted to do injections or you wanted a vacuum pump, I'd certainly prescribe that for you. But a penile implant is really the Cadillac of all the procedures that are available. Works for every type of erectile dysfunction and has the highest patient satisfaction rates. So the patient satisfaction rate with all the treatments available for erectile dysfunction, so believe it or not, the simplest thing is taking a pill, okay? But the patient satisfaction rate with a pill, because of the side effects, just the fact that you're taking a pill, is only about 50%. The next thing patients talk about is a vacuum pump. A vacuum pump is very safe, but a vacuum pump really has maybe a 1 to 5% patient satisfaction rate. Injection therapy, they quote a fairly high patient satisfaction rate of about 50%, but it's very misleading. Why I say that is most patients that can even do an injection, I'd say only about 10 to 12% stick with that type of treatment. So maybe it's 10 to 12% in reality, although some of the literature quotes as high as 40%. Penile implant is a permanent solution. It's a one-time solution, and it has about a 92 to 96% patient satisfaction rate. Psychologically and emotionally, patients that are still sexually active tend to do a lot better in life and seem to be a lot happier. Okay. Besides that, physiologically, the tissue in the penis, in the corpora cavernosum, tends to shrink and retract. The statement, if you don't use it, you lose it, is very true in this situation.